I'm Dr. George Garrow, Chief Medical Officer here at Primary Health Network. So it's been a couple of months since the Food and Drug Administration gave emergency use authorization to the COVID vaccines from Pfizer and Moderna. And since that time, I've actually had the opportunity to meet with many in our communities to hear from them, their concerns and their questions about the COVID vaccines. You know, it's important to remember to get information regarding the COVID vaccines from a trustworthy source. There's a lot of information and sometimes misinformation on social media, so I encourage you to seek information from a reliable source regarding your concerns for the COVID vaccine. Some of the most common questions that I hear from members of our community are the following. Number one, does the vaccine alter my DNA? No. There is nothing in the COVID vaccine that contains DNA. In fact, there's nothing in the COVID vaccines that contain any viruses. These vaccines contain a messenger protein that is a unique signature for the coronavirus, COVID-19. And there is nothing in the ingredients of the vaccine that would alter a person's DNA. Another question that I have heard relatively frequently is, does the vaccine cause cancer? Many of you may know that I'm an oncologist and have practiced oncology for nearly 30 years. And rest assured that I would not put anything in my body or ask my family, my wife, my daughters, or people that I love to do anything that would increase their risk of getting cancer. I hate cancer. I also hate COVID. I've studied very carefully the ingredients of the vaccine and how the vaccine works, and there is no increased risk of cancer related to the COVID vaccine. So another question that I hear relatively commonly is, does the vaccine affect fertility or should I delay getting pregnant if I get the vaccine? So a scientist in the fall of 2020 had posted some information on social media with a theory that the vaccine would cross-react with a protein in the human placenta that could eventually lead to infertility. That information has been proven to be incorrect, and in fact his postings were taken off social media for spreading misinformation. There is nothing about the data that we have from the COVID vaccine to indicate that there is any risk for sterility or infertility related to the COVID vaccines. And then finally, recently I've heard individuals concerned that, you know, if I have a naturally occurring case of COVID, my immunity will last longer than if I get the vaccine. And nothing could be further from the truth. We know that a naturally occurring infection related to COVID-19 will produce some immunity, but that tends to go away after a few months. The benefits of the vaccine is that it not only improves our antibody response and our immunity, but that immunity lasts many, many months longer than a naturally occurring case of COVID. And furthermore, we cannot get COVID-19 infection from the vaccination. The risks of a naturally occurring infection from COVID-19 are substantial, and the risks of the vaccines are very small. Thank you.